If a person with mild traumatic brain injury is not making the appropriate progress or the progress that you feel they should have made after a mild traumatic brain injury, it's important that you refer them to people who are experts in that area who can help them.
For the primary care physician, it's much easier if you can put together a team of people who will assist you. You want a menu of experts who want to see people with brain injuries who will help you. And those people might include a physiatrist, a neurologist, a neuropsychologist, a speech pathologist, occupational therapist, vocational counselor. So for one set of symptoms you might want a neuropsychologist and a speech pathologist and an occupational therapist. For a different set of symptoms where, let's say, return to work is the issue, you might want the neuropsychologist and a vocational counselor involved. So you pick and choose.
You have psychologists or neuropsychologists oftentimes to deal with the cognitive and the emotional problems. You may have occupational therapists to help deal with the fact that these folks are having difficulty with their activities of daily living, and it goes well beyond just washing and dressing themselves, but being able to balance their checkbook, shop, manage a household, things like that. Physical therapists to help with balance disturbances, maybe headaches and pain syndromes, perhaps neuro-ophthalmologists or neuro-optometrists to help with some of the visual disturbances, perhaps psychiatrists to help with some of the medication management. One of the jobs of the team quarterback, oftentimes a physiatrist, specialist in physical medicine and rehabilitation, is to oversee all that activity, make sure everything jives together well, and that the treatment is appropriate and that they're not getting inappropriate treatment.
You want some kind of case manager involved. That could either be a case manager from the Brain Injury Association of your particular state, it could be a county case manager, it could be a vocational counselor, but somebody will help coordinate some of this for you. And you want to make sure that your team of experts are talking to each other so that if one of them generates a report, it goes to all of them. Or you have periodic phone conferences where they're all talking to each other. I think it's really important for the primary care physicians to understand what the resources are. Things like the Brain Injury Association, things like county case managers, those sorts of folks that can really hook them into the system.
In a sense, brain injury really never goes away. Even a mild brain injury that completely resolves is something that's going to be with that person for the rest of their lives.
My experience has been that if you are there for someone with a brain injury and they trust you and you bond with them and you commit to them, over the course of their lifetime, if they're having troubles, they will come back to you. It is so hard for people with brain injury to find someone within the healthcare system that they believe in, who believes what's happened to them, who trusts them, and who they will trust. They need that support.
Make sure that you are getting treatment from a team of professionals that's well organized, integrated, and have experience in dealing with folks with traumatic brain injury, because it's unlike anything else.
Even though aspects of a TBI patient's care may be referred to other specialists, the primary care provider plays an important role in coordinating that care as the team captain. Some of the physical, emotional, or cognitive symptoms may present challenges in the patient's ability to access insurance coverage or negotiate workmen's compensation claims, thereby requiring the primary care provider to take on an advocacy role for the patient. Mild TBI may result in medical complications, and symptoms will require monitoring and ongoing management until they resolve. This may involve the use of medications, the pursuit of cognitive remediation, and repeated neuropsychological testing. Primary care providers will need to guide the safe return to work and resumption of other normal activities, structure office visits, and be cognizant of cultural issues that may impact care and course of recovery. One of the most important factors in improving recovery outcome for patients with mild traumatic brain injury is education of the individual with a brain injury, their family members, and their employers. The most important factor of all may be setting positive expectations for recovery.